We were talking about this last time. It doesn't take very long before drinking too much alcohol before you've got a real serious problem. A blood alcohol test level of 0.12. Legally drunk as far as driving is concerned is 0.08. So as you can see, this is probably pretty close to 2 shots. 2 beers will raise your blood alcohol level up to 0.12. A couple beers, maybe 3 beers, and we're right there. Causes mental confusion, mood swings, loss of judgment, emotional turbulence, slurred speech, loss of emotional control, disturbed sleep, fatigue during the day, insomnia at night, bedwetting as we talked about last time, and then apnea in the form of snoring. For some reason, drunks put their necks in really strange positions so that they snore a lot. It's really kind of odd. I guess they're not really feeling the fact that they're choking themselves. Alcohol consumed at high doses rapidly can lead to alcohol poisoning at a blood alcohol test level of 0.40. That's 5 times the legal drinking, the legal alcohol level for driving. This will cause a depression to the central nervous system. The individual passes out. Often they'll go into a coma. They may go into respiratory arrest where they stop breathing. Their heart will stop beating, of course, and then they die. Sadly, we see alcohol poisoning with a lot of college kids, especially fraternity people. They're not really used to drinking that much. Then they'll have some kind of an initiation rite where they force the individual to drink copious amounts of alcohol, thinking it's funny. This is what they did, so they do it to other individuals. Somebody who's never had very much alcohol to drink, of course, they try to chug a bottle of tequila, and the next thing you know, they're going through this whole process. The sad thing about that is that when somebody starts to go into this process, there's not a whole lot you can do to slow it down. Remember the alcohol level. This is all in your digestive system, and of course we would have to we would have to empty out your digestive system. We can empty out your stomach, certainly, but there's nothing we can do about your small intestines. And of course we can't really get to the small intestines. And since that is the case, and since most of the alcohol, 80% of your alcohol if you're a male, is being absorbed through your small intestines, it's just a matter of time before the individual dies. The sad thing is, of course, you have to remember that you're the drunkest 60 to 90 minutes after you take your last drink. The sad thing is that they're usually alive when we get a hold of them in the emergency room, and there's nothing we can do. We can't dilute out their blood. We can't pull the alcohol out of their system. There's just nothing we can do, and we have to just kind of lay them on a gurney and watch them expire. When other depressants are in the system, of course, now we got a really serious problem. Anything like opiates or sedative hypnotics, it will slow things down even more, and they are more likely to die. And of course, this is what happened to Marilyn Monroe. With novice drinkers with a low tolerance level, deadly effects of alcohol will begin at a lower blood alcohol test level of around 0.20. A lot of times when we're dealing with, especially fraternities, males in fraternities tend to be really not real bright. They assume that since they can consume a half a bottle of tequila without hardly any effect, that their fraternity brother should be able to do the same thing. Well, if the fraternity brother has never had any alcohol before, it only takes 1 beer before they're drunk, it only takes 2 beers before they're really drunk, and 3 beers can be really, actually quite dangerous. So 0.20 is about 4 or 5 beers, and at that point, they can go into the whole process of alcohol poisoning. Respiration severely slows, the abuser goes into a semi-conscious state. they pass out. And they may vomit. If they vomit, the problem with alcohol is that when you throw up, you don't really throw up. It's not like you projectile vomit and get the stuff out of your system. It just kind of comes up and it stays, it doesn't go very far. It's not, your body's not really rejecting it readily enough. So there's a lot of problems with vomiting for these individuals. A lot of times they'll vomit into their throat and they'll suck it back down into their lungs. And now we got a real serious problem because this stuff is toxic and it's quite acidic. And so when it gets down into your lungs, of course, it creates all kinds of interesting problems. The biggest problem is that it may destroy lung tissue, and then the individual will develop pneumonia, and a lot of times they'll die. About 1/3 of all drinkers and 2/3 of all drunks experience blackout. During blackouts, a person seems to act normally and is awake, but afterward cannot recall anything that was said or done. Blackouts are caused by an electrochemical disruption in the brain. It's really kind of weird because some people do this and some people don't. Oddly enough, individuals who are white people don't black out very much. And for that reason, for the longest time, they didn't believe that blackouts existed because it didn't happen to them. But a lot of minorities who have less tolerance with alcohol, of course, have a real serious problem with this. Blackouts are caused, we've already talked about that. Even a small amount of alcohol might lead to a blackout, which is kind of interesting. Blackouts are considered an early indication of alcoholism. Partial recall of events is known as a brownout. I've talked to a lot of Native Americans, and this is very common among American Indians. Researchers have found several explanations for blackouts. EEGs of individuals who black out show a dampening of the P3 and P300 brain waves. Women who have suffered a sexual trauma, this is really kind of weird. Of course, when somebody suffers that type of a trauma, it creates an electrochemical reaction in their brain that is cyclical. If any other type of trauma occurs, then a lot of times it will be cyclical. In other words, it just keeps repeating itself. So individuals females who've had a sexual trauma at an early age were more likely to drink, of course, and were more likely to black out when they did drink. And it has to do with the fact that this circuit in their brain has been created. Researchers have found that alcohol greatly disrupts the activity of the CA1 region of the hippocampus. This is a part that facilitates the formation of memory, and because it formulates memory, of course, now you can't, since it affects the CA1 region. Alcohol also disrupts the NMDA receptor in the hippocampus. This receptor allows for long-term memory to be formed. Whoops, now we can't remember every time we were drinking. No one is quite sure why hangovers occur. It has been speculated that the more congeners in alcohol, the more likely the individual will suffer from a hangover, though even pure alcohol will leave someone with a hangover. Some individuals don't have hangovers. It was stated before that a select member of this class hasn't had a hangover since they were 16. They used to drink a lot. So there you go. Let's throw up. Alcohol does irritate the stomach lining, and this might contribute to the intestinal symptoms. Other symptoms and results include low blood sugar, dehydration, and tissue degeneration. The bottom line, however, is that the more alcohol that you consume, the more severe that your hangover will be. Hangovers are the most severe many hours after the alcohol has been completely eliminated from your system. It's going to take about 24 hours to recover completely from your hangover. So even though that you're relatively functional 12 hours later, you're still feeling the effects of the hangover. Causes nausea, it can cause vomiting, it can cause headaches, thirst. You're dehydrated, so sure you're going to be thirsty. Dizziness, mood disturbances, abbreviated sleep, sensitivity to light, it sounds like a migraine, doesn't it? Sensitivity to noise, there you go, once again, it sounds like a migraine. Dry mouth, inability to concentrate, a general depressed feeling. And partially that depressed feeling has to do with the fact that when you drink alcohol, the initial reaction to the alcohol is an increase in serotonin. And since there's an increase in serotonin, and the more you drink, of course, the more serotonin you get into your system, and this is why so many people drink to get happy. One of the things that happens, of course, in your brain is a downregulation of serotonin receptor sites, and now if you're not drinking, you're depressed because you have fewer serotonin receptor sites. There are fewer of these things, so it's less likely that you're going to be happy after you've been drinking. It's that strange cycle of I drink to get happy, and since I get happy when I drink, I have less serotonin in my brain, so when I'm not drinking, I'm depressed. It's just an odd cycle that people go through. It's a good reason to stay drunk. Chronic high dose users are the most likely to suffer from hangovers. So the more you drink, the worse your hangover is going to be. The more continually that you drink, the more likely you're going to have hangovers when you're not drinking. The best way to control the side effects of alcohol is to control the amount of alcohol consumed. It's very logical, but of course, the more you drink, the higher your tolerance level. The higher your tolerance level, the more you have to drink, and of course, the more likely you're going to have a hangover the next day. The elimination of alcohol from the system is a constant. It's 0.25 to 0.33 ounces of alcohol eliminated per hour. If you drink a beer, that's about an ounce of alcohol. If you drink a glass of wine, that's about an ounce of alcohol. So as you can see, it's going to take you about 4 hours to clear that alcohol out of your system. Hangovers are caused by an imbalance of your hormones, your enzymes, your body fluids, and your body systems. Until these come back into equilibrium, the symptoms will persist. Your body is constantly trying to repair itself. It wants to be normal, so your body will attempt to put all this stuff back into balance. Body fluids are relatively easy. Just drink some water, just drink some juice. Usually orange juice is good because it's got sugar in it and your sugar levels are depleted. And it also adds fluid, so you're good to go if you drink fruit juices. Any fruit juices will do. Some people claim that pineapple juice is the best cure for hangover. You can take analgesics of one ilk or another. Don't take Tylenol. You can take aspirin or ibuprofen, and that should work. That should take care of your headache, the pain in your head. Nothing works on your hormones. Nothing works on your body systems. Nothing works on your enzymes. These are going to have to regulate themselves all by themselves, and it's going to take 12 to 24 hours for that to occur. So as I said before, when you have a hangover, it's going to take you 12 to 24 hours to recover. Recovery can only come with time and rest, sadly enough. Of course, if you have to go to work the next day, now you're SOL. Tylenol should be avoided because it can do additional liver damage when alcohol is present in your system. You've already damaged your liver with the alcohol. Don't add to it by taking Tylenol to get rid of your headache. Use aspirin or ibuprofen. Probably ibuprofen is the best deal. Aspirin will thin your blood, and if you do this on a relatively continual basis, now you've got a really serious problem. I think I told you last time about the young lady, a nurse that I was enamored with. She used aspirin as a prophylactic. She'd take the aspirin before she went out and drank. She didn't drink around me, which is, I guess that makes her not my girlfriend, since she was going out and drinking by herself. But her problem was that she did this so frequently that it thinned her blood, and she couldn't donate blood, and she couldn't, and her periods started to become quite prolonged, so she was having problems. Chronic alcohol usage does more damage to the entire neurochemistry and cellular system of the body than any other psychoactive substance. That's something to think about. Alcohol especially affects the digestive system and liver because it is the organs of these systems that deal with the alcohol in its purest form. So it's your digestive system that you're screwing up when you drink a lot of alcohol. It is these systems that are tasked by the body to rid the entity of these toxins. Anytime you take a toxin into your system, your kidneys have to filter it out, your liver has to work on it to get rid of it. It is absorbed in your stomach, it's absorbed in your small intestine. Usually by the time it gets through your small intestine, it's mostly gone, but it can even affect your colon. Colon cancer in individuals who are heavy drinkers is relatively common, unfortunately. 80% of the alcohol is metabolized by the liver. High doses and chronic usage damages the liver and compromises its function. It can cause fatty liver, it can cause hepatitis, and of course it can cause cirrhosis. Accumulation of fatty acids in the liver can occur after only a few days of heavy drinking, while abstinence will reduce the accumulated fat. Constant abuse can lead to fatty livers. About 20% of alcoholics and heavy drinkers will develop fatty livers. Fatty liver is just one possible outcome. 10 to 35% of heavy drinkers develop alcoholic hepatitis. Hepatitis is an inflammation of the liver which can result in formation of scar tissue, fibrosis, cell death, necrosis, and damage to membranes. And now you've got a liver that's barely functional. This condition is characterized by jaundice. You turn yellow, which is always cute. It has to do with the liver enzymes they're yellow. So if you get too many liver enzymes pumped into your bloodstream, your blood turns yellow, and your skin actually will turn yellow. As much fun as that is. Liver enlargement, tenderness, and pain. When I was in the service, I was a lab tech, of course, and one of our jobs was to check people's liver functions. Alcoholics, of course, and at that time in the service, they encouraged people to drink for no reason whatsoever. I guess it was a manly thing to do. This is during the Vietnam War and just after the Vietnam War. So we had a lot of people that were drinkers, and we had a lot of liver damage being done. Because of that, of course, they'd come in and you could see the whites of their eyes weren't white, they were yellow. You could see it in the beds of their fingernails. So if you pressed on their fingernails, usually it looks white or it looks pink. In their case, it looked yellow. So we had a lot of individuals in the service, especially NCOs, with damage to their livers because they drank so much. Abstinence is the only cure, but the liver damage, of course, it'll never recover. Your liver doesn't really regenerate itself. Some organs will regenerate themselves, the liver is not one of them. When heavy drinking leads to excessive fibrosis and necrosis, the condition is referred to as cirrhosis. Death of tissue and fibrotic tissue, that causes a thing called, well, we call it, you've got all this tissue that's dying, and it's being replaced with with fat. So if you palpate somebody's liver who is an alcoholic, one of the things that you're going to find is that, there we go, you're going to find that it's solid, it's hard like a brick, really weird. I've felt some really nasty, well, they were hard. It was, your liver's right here underneath your rib cage. It's right there. And of course I don't drink, so or take a lot of Tylenol, so my liver's in pretty good shape. But if you're dealing with an alcoholic, of course, one of the things you have to do is you have to figure out how enlarged their liver is. All that dead tissue, of course, it'll expand, and the living tissue will try to get around it, try to move around it. So you get this enlarged liver, and you can palpate somebody's liver, and it'll be right under the rib cage, and then it'll be, you know, halfway down between the pelvis and the rib cage. But I felt livers that were all the way down, and were actually laying on the pelvis, so that it had displaced all of this abdominal tissue. And this is one of the reasons why alcoholics have distended abdomens, is because their liver is enlarged. As attractive as that is. Cirrhosis is the leading cause of death among alcoholics. 12,000 Americans die every year from cirrhosis of the liver. The cirrhosis is not only caused by the alcohol, but the metabolites of the alcohol that are actually more toxic than the alcohol itself. It does create free radicals, one of the things that causes cancer. And acetaldehyde, which is acetaldehyde and formaldehyde are in the same family. So the stuff that we preserve tissue in, formaldehyde, that's what happens with your liver. And it actually smells the same. It's really kind of weird. Sadly, of all the autopsies that I did, the one that smelled, and of course you're in an autopsy room and you're taking, you know, tissue and you're putting it in formaldehyde. So there's formaldehyde around, but in the beginning you don't have any. You don't open, the formaldehyde is toxic, so you don't really open the stuff up until it's time to put something in there, and then you close it back up right away. So there is a smell of formaldehyde. There can be a smell of formaldehyde, but in the beginning there isn't any. And we've cut into people, well, I've done autopsies where we've cut into people, and we got a formaldehyde smell almost immediately. Well, it was an acetaldehyde smell. Of course, bodies, when you cut into them, they have a specific odor. But if the individual was an alcoholic, it's really kind of curious that you cut into somebody and they smell like they're already preserved, as weird as that is. It usually takes 10 years of steady drinking to achieve cirrhosis. Sounds like I'm challenging people, but the reality is if you drink heavily for 10 years, you can expect to have a really bad liver. The reality is that not everybody has the same liver. Some people's livers are stronger than others. Some people's livers can handle the stress. I keep talking about white people as if they are professional drinkers, and the reality is since white people have been drinking for 10,000 years. People that had sensitive livers fell out of the gene pool a long time ago. So, and it's not every single one. I mean, that would be ridiculous to claim that all white people can drink all the alcohol they want without too much damage. But the reality is that because drinking has been one of the things that they do or have done in the past, they have stronger livers. So minorities, individuals who are indigenous peoples, who have only been drinking for hundreds of years instead of thousands of years, these individuals have, their livers aren't used to this kind of thing. So there you go. So some people have really sensitive livers. When I was working up north, there was a family of individuals that were native, and they had become alcoholics. Well, they usually, there were 5 brothers. And of those 5 brothers, they started drinking in their 20s. And by the time they were in their 30s, 3 of them were dead. And the other 2 were still alive, but it was because they had moderated their drinking at some point. But they had really sensitive livers, and so these guys were really suffering from alcoholism. 80% of all cirrhosis in the United States is caused by alcohol. So you have to ask yourself, well, what's the other 20%? Well, the other 20% are other toxins such as ketones, cleaning solutions. All of these things are toxic, and they can cause damage to your liver. And you have to be really careful about what you're breathing because sometimes you can take these things in. 2.5 times more men die of cirrhosis than women, but it's because men tend to drink more than women do. Hispanics seem to be the most sensitive to the cirrhotic effects of alcohol, followed by African Americans and then whites. Of these 3 groups, the group that is more likely to have native ancestry are Hispanics, because people who come from Central South and Central and South America and Mexico, these individuals have native ancestry. A lot of them have native ancestry, and they're more sensitive to alcohol than other groups. Rates of cirrhosis in the United States have waxed and waned along with the popularity of alcohol in the culture. Before Prohibition, 17 out of every 100,000 people suffered from cirrhosis. Now, if you're a medical person and you look at Prohibition, it looks like Prohibition worked. And this is one of the reasons why. I mean, we're using medical indicators. Before Prohibition, 17 out of every 100,000 people in the United States suffered from cirrhosis of the liver. In 1932, at the end of Prohibition, the level had dropped more than half to 8 per 100,000. So if I was, and I am a medical person, so when I look at this, I say, well, geez, Prohibition really worked. Look, it cut cirrhosis of the liver in half. By 1973, of course, Prohibition ended in 1932. So 40 years later, during the disco era, when people were drinking a lot of mixed drinks, a lot of congeners, a lot of fruity drinks, rum and coke and whatnot, the level of cirrhosis had gone up to 14.9 per 100,000. 2004 is the last time that we have, most people don't even look at cirrhosis of the liver, and it's not that important to most people. But in 2004, the level had dropped to 9 per 100,000. So did Prohibition work? Well, if you're a medical person, you're going, yeah, it worked pretty well. Even law enforcement says that Prohibition worked because it cut way down on the on violent crime. Of course, we had the bootlegging was prevalent. The speakeasies, of course, they talk about the speakeasies. But the reality is, if you lived in Iowa or you lived in rural Illinois, it didn't really affect you because there weren't speakeasies in Galena, Illinois, for example, or in Des Moines, Iowa. They had Prohibition for about 50 or 60 years before Prohibition started. So when people look at it, they look at things like New York City and they look at Chicago. So as far as that's concerned, yeah, it increased the amount of organized crime in the United States, but at the same time it reduced the amount of petty crimes that were taking place in the United States by a third. So, you can argue one way or the other. I like to think it worked. Other countries, especially European countries, have rates of cirrhosis that eclipse that in the United States. Kazakhstan, which is a Muslim country, oddly enough, but as far as their brand of Muslimism is concerned, they can drink, and they drink this god-awful stuff. It's just almost like pure alcohol. A lot of, and it used to be part of the Soviet Union, so there's a lot of vodka in Kazakhstan. Anyway, 23.9 per 100,000. It's the leading country as far as cirrhosis is concerned. Germany, 15.4 per 100,000. And if you've ever lived in Germany, you know that they drink a lot of beer. And a lot of people drink to excess. And in Germany, after 5 years, you get a month paid vacation, and it's so that the person can dry out, as weird as that sounds. But you get a whole month off at a spa, paid for by the German government, as weird as that is. When I was in Germany, I went to the German concern and I bought myself a German sweater because they're so cool. The Germans have really cool uniforms, and so they had this sweater with patches on the shoulders so that you wouldn't, if you're firing your weapon, you're not ripping your shoulder up. Anyway, I bought this sweater and it was my size, it was okay. Didn't think about trying it on, took it home and I put it on, it looked like a dress, came all the way down to my knees. Fit me in the shoulders, fit me in the chest, but the rest of it, it went all the way down to my knees. It was really kind of interesting. It took me forever to figure out what was going on, but the Germans, of course, because they drink a lot of beer, they have beer bellies, and because they have beer bellies, they need all that extra material in order to cover their beer belly. And if I had a beer belly instead of a flatter stomach, I'm bragging now, it would have fit, but because I don't have a big stomach, it didn't really fit. Italy, 13.9 per 100,000. Spain, 12.2 per 100,000. France, 12.1 per 100,000. Japan, 7.2 per 100,000. United Kingdom, the Brits, 6.4 per 100,000. Australia, 4.6 per 100,000. Israel, 4.9 per 100,000. And Greece, 3.4 per 100,000. Low doses of alcohol actually aid in digestion. Moderate to excessive doses induce overproduction of stomach acids, which causes a delay of emptying of the stomach. Excessive use can cause gastritis, which is inflammation of the stomach, inflammation in the esophagus, inflammation of the small intestine, inflammation of the pancreas, and this is known as pancreatitis. It's caused by blocked ducts or overproduction of digestive enzymes, ulcers, stomach hemorrhage, gastrointestinal bleeding, and cancer. And of course, working in the hospital, in a military situation, we used to see this all the time. Some people were really sensitive to alcohol, but they wouldn't stop. So we would see people would come in and their throats would almost be blocked up. And it's mainly because they were hypersensitive to the alcohol for some reason. And it caused their esophagus to swell. We've seen gastritis is very common, inflammation of the pancreas. We had this one guy that was an alcoholic staff sergeant. He had an abscess. It caused an abscess in his pancreas. Well, abscesses in your pancreas, because of the pancreas produces all these enzymes, and because of the enzymes, of course, it dissolves everything. So an abscess is an open wound that won't heal. In the case of an abscess in the pancreas, because of the digestive juices, this thing stays open for an extended length of time. It's extremely painful. Normally people, once they get an abscess in their pancreas, it's all over with. So we sent this guy down to Wilford Hall, which is in San Antonio, expecting not to see him again. Normally when we sent somebody to Wilford Hall, they didn't come back. It was a death watch. But this guy did come back, and what happened was he stopped drinking. What he was doing, he was drinking and he was irritating this abscess in his pancreas, which was extremely painful. And they took him down there and he stopped drinking cold turkey, and he started running. And because he started running, the healing process in his body just accelerated markedly. They'd never seen anything like it before. And this guy started running, and started running competitively. And he had this really nasty hole in his it was right here, right under his rib cage. He had this really nasty hole that they put the drainage tube in, and he would run without his shirt on. This is in Lubbock, Texas, in the summertime. So here he is, he's running around with those running shorts on, and that's all and shoes, of course. But he was bare-chested, and he had this really nasty hole in his gut. Anyway, he lived, which was a shock to everybody. Can cause ulcers, stomach hemorrhaging, gastrointestinal bleeding, and cancer. We had once again, it was a staff sergeant. And this guy was a staff sergeant. He'd been in for like 25 years. But he was a staff sergeant because he kept getting busted because of his drinking. Anyway, we had him he had a bleeding ulcer. It was just the most, bleeding like crazy. And so I was working that night, and I kept cross-matching units of blood for this guy. And they kept pumping the units of blood into him, and he kept just bleeding them out through his stomach. And the way they slowed it down was by forcing him to swallow ice chips, and the ice chips cooled. It slowed down the bleeding process in his stomach. It cooled his stomach up a great deal. So eventually we got him cured, and we cross-matched. I cross-matched every unit of blood. I worked for let's see, it was an 8-hour shift. It was a 12-hour shift. It was a 12-hour shift, and I worked 16 hours cross-matching blood. Once you start cross-matching blood, you can't stop. You've got to finish the cross-match. You can't hand it off to somebody else. So we saved his life, and then about a week later, he checked himself out of the hospital and went on a bender, and of course his ulcer opened up again. He bled to death, and I checked him into the morgue. So 1 week I'm cross-matching blood for this guy, trying to save his life, and the next week I'm checking him into the morgue. That's not the first time that happened. It was the first time it happened with an alcoholic. Strangely, you can live on alcohol, as each drink carries about 150 calories, but it tends to be poor nutritionally, as there are few vitamins, minerals, or proteins. They don't have vitamin-fortified beer, for example. Heavy drinkers can receive half of their calories, but little nutrition from their drinking. It's very common for these individuals to have B1 deficiencies, which can lead to beriberi, heart disease, peripheral nerve degeneration, pellagra, scurvy, and anemia. And a lot of times this creates open sores in their mouth, the beriberi and the pellagra, and the scurvy. It's weird as that sounds. And when they have those open sores, of course that's a kind of a positive thing, because they can't drink it. It hurts too much to drink alcohol. With heavy usage, intestinal complications may occur, which can result in secondary malnutrition where nutrient absorption is impaired. Alcohol is so toxic that the liver must work overtime to rid the body of its effects. Unfortunately, the other important function of the liver is to store glucose for emergencies in the form of glycogen. With the stress of metabolizing alcohol, the liver is too busy to produce and store glycogen. Because of this, alcoholics may suffer from hypoglycemia, especially if they are drinking their sustenance. In other words, they're not eating anything, just drinking. And of course, like I said, you can live off of alcohol. There are lots of calories there. Unfortunately, there's not enough nutrients. If the individual is taking in sufficient nutrition, the extra carbohydrates in the alcohol can cause hyperglycemia. So it's very common for alcoholics to be diabetic, especially, well, type 2 diabetic. Light to moderate drinking of alcohol actually can help the heart. Chronic heavy drinking can lead to heart disease by the factor of 6 times, hypertension by a factor of 2 to 3 times, cardiac arrhythmia, cardiomyopathy, which is enlarged, flabby, inefficient heart. Alcohol damages the striated muscles of the heart, The hearts of heavy drinkers are often twice the size of a normal heart, and a normal heart is about this size. It's about the size of your fist, so you can imagine it's more like a softball instead of a fist. 80% of the heavy drinkers have heart muscle abnormalities, though only 2% suffer from full-blown alcoholic heart muscle disease. Stroke and other intracranial bleeding is not that uncommon. Usually within 24 hours of heavy drinking, of course, it dilutes your blood, so it makes it more likely that you'll have a hemorrhage, a cerebral hemorrhage. Not so much the blood clot, it thins your blood, so it keeps you from having blood clot in your brain, but it will cause hemorrhaging or aneurysms. Alcohol kills brain cells by limiting the brain's ability to use glucose and oxygen, though low moderate doses don't seem to cause permanent damage. Heavy doses cause direct damage to the nerve cells, and this is the problem with binge drinking, where you don't drink for most of the week, and then on the weekends you get snockered, and you stay snockered all weekend. Those heavy doses of alcohol will destroy brain tissue. Malnutrition caused by alcohol will not only damage brain cells, but brain chemistry as well. Brain atrophy has been documented in up to 100% of alcoholic autopsies. Dementia is a result of prolonged heavy drinking as well. Heavy drinking can lead to two serious brain maladies, Wernicke's encephalopathy and Korsakoff's psychosis. Wernicke's encephalopathy is where the individual suffers from delirium. They have a hard time walking because they feel like they feel dizzy all the time. The biggest problem is when they close their eyes. So they have a hard time blinking, even when they're walking, and when they blink, of course, all of a sudden they'll lose their balance. So it has to do with them closing their eyes. It has to do with the inner ear. Visual problems, of course, alcohol causes visual problems. As someone in the class was saying, the best way to drive when you're drunk is to close one eye. And of course, if that's the only way that you can drive, now you've got some really serious visual problems. Ataxia is the inability to coordinate movements in the lower extremities, so they have a hard time walking. You've probably seen videos of individuals who were drunk and they had a really hard time putting one foot in front of the other. They kept tripping themselves. Korsakoff's psychosis has to do with a B1 deficiency in the brain. This causes disorientation. It causes memory failure, where they can't remember things. But they have what they refer to as confabulation, where if you tell them anything, they'll believe it. And this is known as confabulation. They'll repeat false memories as if they had those memories. Epilepsy is also related to heavy alcohol intake. Epilepsy is 10 times more prevalent among alcoholics. What is epilepsy? Epilepsy is a electrical discharge in the brain that has nothing to do with what's going on in the brain. Of course, it can cause a tissue damage in the brain or nerve damage, and of course that can lead to an epilepsy-like situation. As far as the epilepsy is concerned, a lot of these problems are more prevalent in select individuals or select individuals with curious genetic structures. Because of this, of course, you never know who's, if people aren't drinkers in your family, and then all of a sudden you've got a drinker, they could develop epilepsy. Why does he have epilepsy and nobody else has epilepsy in the family? It's because he drinks, and of course it causes that rearrangement of brain tissue. And that's why he's suffering from this. It gets kind of interesting. I'm thinking of a situation, we had a pilot who developed epilepsy, and you can't fly and take medicine for epilepsy. So he tried to hide it. But his problem was, and the more he drank, the worse his epilepsy got. So since he couldn't fly, since they started giving him the epilepsy medication, he started drinking more, and he started having more epileptic seizures. The thing just snowballed, and eventually, of course, it got to the point where we had to board him out of the service, medically board him out of the service. But it had to do with his heavy drinking. We kept trying to tell him that he needed to stop drinking, and if he would stop drinking, his epileptic symptoms would go away, and then he could go off the medication and he could start flying again. But of course, his coping technique was to drink, and so since he couldn't fly, he had all these negative reactions to what was going on, and eventually we kicked him out of the service. The reproductive, and he was a lieutenant colonel when this thing first started. He got his bird. He got his bird, but we boarded him out about 3 months later. So he was able to, and he had 18 years in the service, if I'm not mistaken. He was up for base commander, you know, that kind of stuff. It was really kind of interesting. So all this stuff was secret because they didn't want anybody to know that he had a drinking problem. They didn't want anybody to know he had a problem with epilepsy. So it was one of those secret things. The reproductive system and sexual desire are also affected by alcohol, whereas light drinking actually lowers inhibitions and increases desire, the intensity of orgasms. Heavy drinking, desire and the intensity of orgasms. Heavy drinking decreases desire and lessens the intensity of your orgasms. Research with heavy female drinkers found that 36% only had orgasms 5% of the time. Chronic drinking can inhibit ovulation. It can decrease gonadal mass. These are your ovaries. Since it's reducing the gonadal mass, it makes it less likely that you'll get pregnant. It delays menstruation, it causes sexual dysfunction, it promotes infertility, it increases the chances of spontaneous abortion in women. So drinking, heavy drinking is kind of a birth control, can be a birth control. The reproductive system and sexual desire are also affected by alcohol. Whereas low to moderate drinking can lower inhibitions and enhance the psychological aspects of sexual activity in men, chronic heavy use can lead to the inability to perform. Research, Shakespeare used to talk about this all the time. He would tell dirty jokes about men who were so drunk that they couldn't function. And of course, most people miss it because he doesn't say, hey, they couldn't perform. He says it in a funny way. If you read Shakespeare, there's a lot of dirty jokes in there that people just don't get anymore, which is a good thing because then they wouldn't put on any Shakespeare plays. Research found that 71% of alcoholics suffered from erectile dysfunction compared to 7% of abstainers. 71% of alcoholics. Chronic heavy usage leads to a lowered testosterone and an increased estrogen level. This gets really weird. So the more you drink, it's very manly to drink a lot. Well, the reality is, the more you drink, the lower your testosterone level. So it's not manly at all. And it also increases your estrogen level. So if you're a really heavy drinker, the probability is that you're becoming more and more female all the time. It will cause breast enlargement, which is, man boobs, testicular atrophy, your testicles will shrink, low sperm count, loss of body hair. You have a hair pattern that is more similar to a female than to a male. Loss of sexual desire, of course, performance anxiety once sexual activity is resumed. The most serious effect may be social. Drinkers tend to socialize mainly in bars and at parties where normal sexual relationships are circumspect. So if you're actually dealing with an individual that drinks a lot, one of the things that is happening is that it's increasing their estrogen level. So they start acting more and more feminine all the time. When I was working in a rural health clinic in Oklahoma, we had a guy that was a real heavy drinker, and he had a low T level. And part of his low T level had to do with the fact that he was that he drank so much, but he also had a natural low testosterone level. So the way it worked, if he wanted to have sex during the week, of course he was married. If he wanted to have sex during the weekend, we would give him a shot of testosterone every Thursday. We give him a shot on Thursday. So we knew when he was thinking he was going to get to have sex, because he would come in on Thursday and get a testosterone shot, as weird as that is. He could have taken care of the testosterone shot just by decreasing the amount of alcohol that he drank, but of course that's not something that happened. While the connection between breast cancer and drinking is questionable, the possibility of developing cancers in the area that come in contact with the alcohol is 6 times greater than those who do not imbibe. Mouth cancer is very common in alcoholics. Throat cancer is very common. Esophageal cancer, of course. These cancers are 7 times more likely for those who use tobacco but do not drink. For people who drink and smoke both, the possibility of developing these cancers increases by a factor of 38. And of course, liver cancer is very common with people that drink alcohol. I had a friend when I was in Omaha. She didn't smoke unless she was drinking, and then she always smoked and drank at the same time. So anytime she had a couple beers, she had to smoke a cigarette, as weird as that sounds. And of course, she was setting herself up for cancer. Alcohol leaches minerals from the body, leading to a greater risk of fracture. Myopathy, muscle inflammation can be caused by chronically imbalanced electrolytes due to alcohol consumption. Dilation of blood vessels near the skin can lead to a chronic reddish complexion, while the toxic effects of alcohol may lead to thinning of the skin. Acne rosacea. Acne rosacea is a reddening of the area around your nose and your cheeks, right under your eyes. That's acne rosacea. Looks like you've got pimples, but of course it's not pimples. It is dilation of the blood vessels in that area. Psoriasis, eczema, facial edema. In other words, your face swells up. You get your face will fill up with fluid, as weird as that is. Heavy drinking disrupts the immune system, but especially the white blood cells, making the individual susceptible to infections. People who are drinkers have more respiratory infections. They're more likely to develop tuberculosis, and they're more likely to develop pneumonia if they do get an infection. Pneumonia used to kill a lot of people. Now, of course, we can treat it. We have antibiotics that can treat it. But alcoholics, it's a little bit different for alcoholics. Chronic heavy usage of alcohol can make the individual a great deal of fun. They have memory problems. They may have hallucinations. They may be paranoid, which is never fun. Severe depression when they're not drinking. Insomnia, intense anxiety, amnesia, and blackouts, of course. Due to damage to the frontal lobes and hippocampus, the individual often has problems with concentration and in planning new information in the brain. So this isn't a way to cram for midterms. On the average, heavy drinkers reduce their lifespan by about 15 years. There are 140 million drinkers in the United States. Of these, 10 to 12% will become alcoholics. 14% of male drinkers and 6% of female drinkers will become alcoholics. Men become alcoholics at a younger age than women do, and for this reason, they tend to die younger than women do from their alcoholism. 20% of all drinkers, heavy drinkers, consume 80% of all the alcohol. So when the Johnny Walker or Crown Royal, when they advertise, they're not really advertising at sometimes drinkers or at holiday drinkers. The people that they are advertising toward are the individuals who drink a lot, because they consume most of the alcohol. Whereas, well, I told you about my dad, whenever he went off for a deployment, it wasn't really a deployment, when they went off for training in the summertime, he would take a fifth of whiskey, and he would come back with just a little bit in the bottom of the bottle. But when he wasn't around the Army, he didn't drink. That he's not a heavy drinker. He wouldn't be the person that they would try to get to buy their alcohol. They're really aimed at the heavy drinkers, the people that drink every day. People can drink as much as a fifth of whiskey every day. Red Fox, who was a comedian from the 1970s and 80s, Red Fox said that he knew he was an alcoholic when he drank a fifth of whiskey and he didn't get drunk. He said he knew he was an alcoholic at that point and he needed to do something because he wasn't feeling any effects from the alcohol. And of course, the more you drink, the more higher your tolerance level. We had an individual when I was in the military. This guy had an automobile accident. This is in Germany. He had an automobile accident, and the Germans, of course, you can't say no to the Germans. The German Polizei. Anyway, they drew his blood, and his blood alcohol came back 0.275. 0.275 is really high. I mean, that's really high. That's almost 4 times normal, 3.5 times what is legal. And he was fully functional. He would have gone to work, and he would have gone to work with a 0.275 blood alcohol level. He was a fully functional alcoholic. He drank a lot, and if he didn't drink, of course, the effects were worse on him if he didn't drink at all. Of course, they boarded him out of the service. We didn't keep him around for very long. Why am I talking about this? They consume 80% of the alcohol. He was drinking schnapps, but he was drinking like half a bottle of schnapps before he went to work. At lunch, he would drink more. He had a mouthwash bottle that he filled up with alcohol, and he would go out to his car and he would drink mouthwash. Or it was whiskey, but he had it colored blue so that it looked like whatever that blue mouthwash is. Anyway, he was fairly functional, and he drank a lot of alcohol. And so, I mean, these are the people that the advertisers are aiming at. They're not aiming at me, but I don't drink at all, but they're not aiming at my wife. She may drink, a bottle of wine a week or whatever, that she doesn't consume enough alcohol for them to even care about. The individuals that they care about are the alcoholics. And of course, alcoholics will go through the DTs, and so they'll put pictures of monsters in their advertisements, which are the visions that these individuals get when they start going through the DTs. Alcohol production and usage have been controlled by financial factors since before the beginning of the United States. And we keep talking about greed in the United States and how greed controls things in the United States. Well, it works the same way with alcohol. And just like slavery, its detractors had been screaming into the wind. Founding father Dr. Benjamin Rush warned of the deleterious effects of alcohol as early as 1804. Dr. Thomas Trotter was coming to the same conclusions at the same time, but their administrations fell on deaf ears. If you use it, then you don't want to hear that. You don't want to hear about how bad it is. Marijuana smokers don't want to hear about any of the negative things that can potentially happen to them. They would rather smoke and the negative things happen to them and then they go, what a surprise, I didn't know this was going to happen. Well, they just ignore any negative information. In 1941, Dr. E.M. Jellinek and Carl Bowman developed a classification of different forms of alcoholism. The comfortable classification of alcoholics has changed over time as the understanding of the addiction process has progressed. According to a recent reclassification by the National Institute on Alcohol Abuse and Alcoholism, constructed in 2007, there are 5 subtypes of alcoholics based on 6 criteria. The 6 criteria are, do you have a family history of this problem, the age of onset of drinking and problem drinking, patterns of craving and abuse, use of additional drugs, and mental conditions. Subtype 1, youth, young adults, 31.5% of U.S. alcoholics are of this subtype. They are characterized by relatively low rates of simultaneous drug abuse and other mental conditions, low rates of family alcoholism, and they rarely seek any kind of alcoholic treatment. And these are the young adults. These are the guys right out of college. These are fraternity guys who consume a lot of alcohol when they are in college. Young antisocial, 21% of U.S. alcoholics are young antisocial alcoholics. They're usually in their mid-20s with precocious onset of regular drinking and alcohol-related issues. Over 50% come from families with alcoholism problems, and about 50% have an antisocial personality disorder and a major depression, bipolar disorder, and anxiety problems. Over 75% smoke cigarettes and marijuana, and a large percent also have had cocaine or heroin addictions. More than 30% of them look for help, and that's because of all of these other problems. It doesn't usually have to do with the alcohol. It has to do with the heroin, it has to do with the cocaine, has to do with the mental illness that they're suffering from. Subtype 3, functional alcoholics. Functional alcoholics represent about 19.5% of the U.S. alcoholics. Usually middle-aged, well-educated, with stable jobs and families. Approximately 33% present a multi-generational family history of alcoholism. About 25% presented major depressive illness during their lifespan, and about 50% were smokers. Subtype 4, intermediate familial. 19% of U.S. alcoholics are intermediate familial alcoholics. Middle-aged and coming from multi-generational alcoholism, about 50% have presented clinical depression and 20% bipolar disorder. So they're using the alcohol as a self-medication. Most of them smoked cigarettes, and about 20% have used cocaine and marijuana. Just 25% looked for a cure, and of course it has to do with their mental illness. They're building up a tolerance to the alcohol, and of course it's not helping their mental problems. Subtype 5, chronic severe alcoholics. About 9% of U.S. alcoholics can be categorized as chronic and severe. Chronic severe. The majority are middle-aged individuals with early onset of drinking and alcohol-related issues with high rates of antisocial personality disorder and criminality. 80% presented multi-generational alcoholism. They were the most prone to psychiatric conditions and drug abuse. 70% of them looked for help, forming the main category in the alcoholic treatment group. The coexistence of psychiatric and drug abuse issues were linked with severity of alcoholism and the date of beginning the treatment. Help seeking was found to be relatively rare. People choosing mainly to attend Alcoholics Anonymous meetings and to participate in other 12-step programs. Really interesting, because what we see here is high rates of antisocial personality disorder. And these are most of the people in Alcoholics Anonymous, which is kind of curious. So the reality is we have a mental illness and we also have alcoholism. So which do you treat first, the alcoholism or the mental illness, the antisocial personality disorder? And the answer is, if you don't treat the alcoholism first, wait a minute, let me get this straight. Their coping technique, alcohol is their coping technique. So the first thing that you have to cure is you have to work on their antisocial personality disorder. You need to cure their mental illness before you even try to tackle the alcoholism. The alcoholism is a symptom of the antisocial personality disorder. So potentially you can cure them, you can take care of their entire situation by dealing with their mental illness. And it will make the alcoholism go away. Because once the mental illness is gone, they don't need the coping technique, so they will stop drinking. Family studies have shown that there is a hereditary influence on alcoholism. The same genes that potentially lead to addiction also may express a proclivity to become an alcoholic, and that is, of course, the DRD2A1 allele. We know it causes all kinds of interesting problems. It makes people jump out of airplanes with parachutes. It makes them do crazy things. It makes them wander. It makes them wanderers. And of course, they're more likely to become addicted to a substance because of this allele. And now we know, of course, it also affects alcoholics. But people who drink may have several other genetic anomalies that might lead to alcoholism. Many Asians have an ALDH2 gene that encodes aldehyde dehydrogenase. Because the person doesn't have as much of the enzyme to rid themselves of toxic alcohol, they become ill when they drink. And this is very common with Asians. They'll start to vomit if they consume any alcohol. It's one of the reasons why a lot of the medications in Japan are not mixed with alcohol, because a lot of Asians are allergic to alcohol. Half of the Japanese and many other Asians have more efficient alcohol dehydrogenase and less efficient aldehyde dehydrogenase, which leads to a buildup of acetaldehyde, which in turn creates a toxic level of acetaldehyde, resulting in flushing, tachycardia, headaches, edema, hypertension, and vomiting. So if we're dealing with an individual that has never had alcohol before, and they take a shot of sake, right away their cheeks will flush, they'll get heart palpitations, their heart starts racing, it gives them a headache, their face will swell, and a lot of times they will just vomit it right back up. Other indicators that heredity strongly influences alcoholism is such characteristics that run in families or groups, such as tendency to have blackouts, greater initial tolerance to alcohol. I told you about the young lady from Romania who doesn't get drunk. Her tolerance to alcohol is just amazing. And of course, alcohol's toxic. So if she drinks, I don't know why she would drink, she doesn't get drunk, she doesn't have any effects from it. It would be like drinking water as far as she was concerned. I don't know why she would drink. There has to be a reason why people are consuming alcohol, to feel happy or whatever. It doesn't have any effect on her at all. So why would she drink it? Because everybody else is drinking, I guess. An impaired decision-making area of the brain, major shift in personality during drinking, an impaired ability to learn from mistakes, retrograde amnesia, low levels of response to alcohol, cirrhosis, and alcoholic psychosis. The environment that an individual inhabits can have a strong influence on whether they drink alcohol. Factors that can lead to alcohol abuse include child abuse, alcohol or other drug abuse, abusing parents, friend or relatives, chaotic familial relations, peer pressure, and extreme stress. One of the most powerful environmental factors in alcohol or drug abuse is sexual, physical, or emotional abuse at a young age. In one study looking at 275 female and 556 male alcoholics, 20% of the men and 50% of the women said that they had been subject to physical or sexual abuse as a child. So they were using this to forget. They were using the alcohol to forget, which works really well with people that black out. So potentially they're using it as a form of self-medication. When someone drinks alcohol, their brain-body neurochemistry changes. The brain body will try to protect itself from the effects of the alcohol by developing a tolerance to the substance. The drinker will develop metabolic tolerance by metabolizing the alcohol more efficiently. The liver of the drinker will manufacture more enzyme to break down the alcohol and the metabolite acetaldehyde. This also accelerates the breaking down of other drugs, including prescription medications. So if somebody is taking a medication, they decide to start drinking, or they do start drinking, they will develop a tolerance to the alcohol, and the tolerance to the alcohol will also change their prescription medications, as weird and interesting as that is. So when a pharmacist is talking to a patient, or a doctor is talking to, actually it's a job of the doctor to find out how much alcohol this person is consuming, it may change their prescription. They may have to double the dosage in order to get the same effect because they have started drinking alcohol. Or normally it doesn't work on this select individual. Normally it works very well on this individual. Well, how can I explain this? Okay, we've got this guy that's 42 years old, and he's got hypertension, and he's a drinker. But he doesn't tell his doctor that he's a drinker. He weighs 200 pounds, and he drinks. So the doctor's going to give him a prescription for somebody, for the normal person that weighs 200 pounds and is 42 years old. There is a formula that doctors will use. So they'll give him that much medication, but as far as he's concerned, it may not work on him. And the reason it doesn't work is because he drinks. So what they'll have to do is they'll have to increase his dosage. When someone drinks alcohol, wait a minute, we've already talked about that, didn't we? No. Pharmacodynamic tolerance takes place in the brain when brain neurons and other cells become resistant to the effects of alcohol by increasing the number of receptor sites for GABA in the brain, becoming less sensitive to alcohol. Behavioral tolerance occurs when the drinker learns to handle their liquor, changing their behavior to make it more acceptable and acting in a way to hide their drunkenness. Hangovers represent the individual's withdrawal reactions to the alcohol. 85 to 95% of those experiencing withdrawal will have only minor symptoms. Rapid pulse, sweating, increased body temperature, hand tremors, anxiety, depression, insomnia, nausea, or vomiting. 5 to 50, we had these hand tremors. Where is it? Yeah, hand tremors. We had a guy, a guy that had been in the Navy, and strangely enough, the Navy does really weird things. He had, let's see, he was a little short guy with a great big head. It was really kind of strange, fairly unattractive fellow. But he had been in the Navy, and what he did in the Navy was he was a jockey for an admiral as a Navy personnel. And this was after World War II, after the Korean War. The Navy kind of got away with stuff. If you were an admiral, they assigned you an individual to take care of your house. And it was usually somebody from the Philippines, as weird as that is. They gave you a houseboy if you were an admiral. But then after Vietnam, they stopped doing all that. So admirals had all of these privileges that other people didn't have. If they owned horses, then they could get a military person to take care of the horse. His horse was a racing horse. So he had a jockey who was a military person. And this guy was a jockey. A little bitty short fella. He's about probably 4'10", maybe. Weighed 110, 115 pounds. Really skinny. Well, once they stopped doing that, this is during the Vietnam War, they stopped doing that. They stopped giving naval personnel all kinds of interesting perks. He had to get out of the Navy for one thing. He had to get out of the Navy because it was the Congress had gotten really pissed off about the Navy having all of these really strange privileges. So the people that were the ones that were the privileged, not the privileged individuals, but the ones that were being used by the privileged individuals, they had to get out of the either get out of the service or change services. So this guy joined the Air Force and he became a lab tech. But what we discovered was the way that he was staying so slender was by drinking. He drank most of his meals. And he was a good jockey and he only weighed 110, 115 pounds. But because he was an alcoholic, he had hand tremors. And here he is, he's a lab tech. And of course, lab techs, of course, you're measuring things all the time. He's got both hands just shaking like crazy. So here he is, he's going through training, and he's got these hand tremors, so he can't measure anything because he can't hold the pipette. He can't measure anything. The other thing he can't do is draw blood, because he's trying to draw blood with his hand just shaking like crazy. And of course, he was in my group. So you know, we would all go upstairs together to draw blood. Well, he screwed up most of his blood draws. He just blew people's veins all over the place. So what would happen is we would have to go back up later, and of course we would have to find a vein that he hadn't blown apart, and we would have to draw the blood for it. But eventually they boarded him out of the service. Anyway, he had really bad head tremors. 5 to 15% will experience life-threatening major symptoms of withdrawal, tachycardia, transient tactile, auditory, or visual hallucinations and illusions. And these, of course, are the DTs, delirium tremens. Psychomotor agitation, grand mal seizures, and, of course, delirium tremens. Why don't we stop right here? We'll pick this up next time and finish the chapter on Tuesday.